Hello everyone, today's topic is scalp. First of all, definition of the scalp. What is scalp? It is a soft tissue which covers the clavaria of the skull. Clavaria means skull cap. Soft tissue covering the clavaria of the skull. Now, extent. कहाँ से कहाँ तक जा रहा है scalp? Anteriorly, supraorbital margin, posteriorly, external occipital protuberance and superior nuchal lines, and laterally zygomatic arch. Anteriorly, it's superciliary arches. Up to here, scalp extend. Now, posteriorly, scalp extend up to external occipital protuberance. This is external occipital protuberance, and these are the superior nuchal lines. Now, laterally, if we see, it extend up to zygomatic arch. This is the zygomatic arch. Now, next is layers of scalp. In scalp, there are 5 layers. Mnemonic of scalp is SCALP. And in scalp, we read rule of 5. Rule of 5. We have to remember rule of 5. 5 layers, 5 nerves, 5 arteries, 5 veins except lymphatic drainage. Nerves, anterior to auricle 5, posterior to auricle 5. Next, here comes a question on layers of scalp. How many layers we have in scalp? 5 layers. 5 layers. SCALP. S stand for skin. C for subcutaneous. In subcutaneous tissue below the skin. C. Third is A. Epicranial muscle, and it's epineurosis. L stand for loose subeponeurotic. Subeponeurotic means below the epineurosis, and P stand for pericranium. Peri means outside the cranium or outer periosteal layer of the skull. Now, first of all, one more thing. Question comes on surgical layer of scalp. Surgical layer of scalp. What do you mean by surgical layer of scalp? Out of 5 layers, first 3 layers form surgical layer of the scalp, because these three layers are intimately connected and move as a single unit. Now first of all, skin skin contains what type of skin? Thick skin. In histology we study about skin types. The skin is basically of two types, thin skin and thick skin. In scalp we have thick skin. It contains hair, sebaceous gland and sweat gland. Now question comes on sebaceous gland. Question comes, most common site of sebaceous cyst. It is scalp. Common site for formation of sebaceous cyst is scalp. Next is dense subcutaneous tissue. Now subcutaneous, it's sub means below, cutaneous, cutis is skin, means below the skin, and dense represent type of connective tissue. It is dense connective tissue, dense subcutaneous tissue. It is composed of close network of fibrofatty tissue. It contains large blood vessels and nerves of scalp. Contains blood vessels and nerves of scalp. One important point is here is blood vessels of scalp, walls of vessels is adherent to fibrous network of dense subcutaneous tissue, and this forms a clinical point. Now clinical is, in case of open wound injury, walls are adherent to the fibrofatty tissue. Then open wound injury, there is profuse bleeding. Bleeding can be arrested by pressure against the underlying bone. And in case of closed wound injury, there is extent of the wound or the swelling is localized, but pain is more with little swelling because of pressure. Now third is rich blood supply. If there is any injury, any kind of avulsion of scalp in this layer, then because of rich blood supply, healing is good. Now third is epicranius muscle and its epineurosis. Now epi means above, cranius means above the cranium. Epicranius muscle and its epineurosis. In muscle we have to study two attachments. पहले हम बोलते थे origin insertion. Nowadays we call attachments. Now epicranius muscle and its epineurosis. First muscle is occipitofrontalis muscle. It's a large muscle, pair of occipital bellies and pair of frontal bellies. See in diagram, muscles of scalp, occipitofrontalis muscle. This is occipital belly of occipitofrontalis muscle, and this is frontal belly of occipitofrontalis muscle. Now, occipital bellies arise from lateral 2/3 of superior nuchal lines. If we go lateral, occipital belly जो होगी वो अराइज होगी कहाँ से? लेटरल 2/3 ऑफ सुपीरियर न्यूकल लाइन एंड मेस्टॉइड बोन. डायग्राम में देखें तो ये सुपीरियर न्यूकल लाइंस के लेटरल, यहाँ से लेटरल जो पोर्शन है, लेटरल 1/3 एंड ये मेस्टॉइड बोन है, यहाँ से इसके कुछ पोर्शन से इधर से ओरिजिन होगा ओसिपिटोफ्रंटालिस मसल का, मसल की occipital bellies का. And frontal bellies have no bony origin. Frontal belly have no bony origin. Frontal belly of occipitofrontalis muscle is considered as a facial muscle. Facial muscles are subcutaneous muscle, no bony origin. It arises, frontal belly of occipitofrontalis muscle arises from skin and subcutaneous tissue of eyebrow and root of the nose. Now frontal bellies of occipitofrontalis muscle and occipital bellies of occipitofrontalis muscle both come and unite to form a epineurosis, and this epineurosis is termed as epicranial epineurosis or galea aponeurotica. Now one variable sheet, second muscle in scalp which is variable, that is temporoparietalis muscle. It arises from the galea aponeurotica and inserted into the root of the auricle. It's a variable muscle, variable. And this is galea aponeurotica. These are the frontal bellies and these are occipital bellies, and this whole is epineurosis of this. Now क्वेश्चन आता है यहाँ पे, मीटिंग ऑफ फ्रंटल बेलीज विद द गेलिया एपोनेरोटिका कहाँ पे मीट हो रहा है? मीटिंग ऑफ फ्रंटल बेली विद द गेलिया एपोनेरोटिका इज इन फ्रंट ऑफ कोरोनल सूचर. फ्रंटल बेली ये कोरोनल सूचर है हमारा, इससे पहले ये गेलिया एपोनेरोटिका में इंसर्ट हो जाएगी. अब एक्शन इम्पोर्टेंट है. इफ alternate contraction of occipitalis and frontalis move the entire scalp backward and forward. Second action, acting from above, the frontal bellies raise the eyebrows, जैसे सरप्राइज और हॉरर में होता है. तो सरप्राइज जो हो रहा है वो फ्रंटल बेलीज पुल कर रही है आईब्रोज को अबव की तरफ. एक्टिंग फ्रॉम बिलो, ट्रांसवर्स रिंकल्स ऑफ फोरहेड वो भी फ्रंटल बेली के एक्शन की वजह से आता है. नाउ नेक्स्ट क्वेश्चन इज, गेलिया aponeurotica is sensitive to pain. Sensitive to pain. Answer is yes. Galea is sensitive to pain. Next, loose subaponeurotic tissue. Now लूज रिप्रेजेंट कर रहा है लूज एरियोलर टिश्यू टाइप को। कहाँ पे है? सब एपोन्यूरोटिक, सब मीन्स बिलो, एपोन्यूरोटिक मीन्स बिलो द एपोन्यूरोसिस ऑफ एपिक्रेनियल मसल्स, बिलो एपोन्यूरोसिस। तो ये इसकी पोजीशन को डिफाइन कर रहा है। लूज सब एपोन्यूरोटिक टिश्यू कंसिस्ट ऑफ लूज एरियोलर टिश्यू. It is a potential space. It is a potential space beneath the epicranius muscle and its aponeurosis. It contains emissary veins. What it contains? It contains emissary veins. Now, loose aponeurotic tissue is considered as dangerous area of scalp. Why it is considered as dangerous area of scalp? Because it contains emissary veins. These are the emissary veins, and these emissary veins are connected to dural venous sinuses. Emissary veins, now question arises, what are emissary veins? Emissary veins are veins which are devoid of walls and communicate with veins of scalp, communicate between the veins of scalp and intracranial venous sinuses. ये extracranial vein है, ये dural venous sinus है, इन दोनों के बीच का जो connection है that is the emissary vein. Therefore, any infection of the scalp, any infection in the loose subaponeurotic area spread readily into the intracranial sinus via emissary veins. Now, swelling. अगर यहाँ पे swelling आएगी तो swelling आएगी जर्नलाइज swelling, टाइप ऑफ swelling आएगी जर्नलाइज. और dense कनेक्ट जो सेकेंड लेयर थी, जहाँ डेंस सबक्यूटेनियस जो लेयर थी वहाँ पे स्वेलिंग थी लोकलाइज, यहाँ जर्नलाइज. जर्नलाइज स्वेलिंग आएगी, अफेक्ट होल डोम ऑफ द स्कल. नेक्स्ट इसका क्लिनिकल है ब्लैक आई. ब्लैक आई, ब्लड कलेक्टेड इनटू द फोर्थ लेयर. कैसे ब्लैक आई हो जाए? आँख में कैसे चला जाएगा? फोर्थ लेयर से, फोर्थ लेयर में ब्लड कलेक्ट हुआ, slowly gravitates into the eye. क्यों? Because frontal bellies of occipitofrontalis muscle has no bony attachment. Next clinical is safety valve hematoma. Safety valve hematoma. Sometimes fracture of the cranial vault in children is associated with tearing of the dura mater. कुछ इंजरी हो गई, ड्यूरा मैटर टेयर हो गया, पेरिक्रेनियम भी टेयर हो गया, तो ब्लड फ्रॉम द इंट्राक्रेनियल हेमरेज कम्युनिकेट विद द सब एपोन्यूरोटिक स्पेस ऑफ द स्कैल्प थ्रू द लाइन ऑफ द फ्रैक्चर, एंड साइंस ऑफ cerebral compression do not develop until the subaponeurotic space is full of blood. Therefore, collection of the blood in the fourth layer often forms a safety valve hematoma. Next is capsaicin and cephalohematoma. Capsaicin क्या होता है? It is a temporary swollen edematous condition of a portion of a scalp. It generally occurs during the passage through the birth canal because of the interference of venous return. It's encephalohydrocele is a swelling under the scalp and it generally contains CSF. Next is pericranium. Pericranium means peri in front of the, above the cranium के ऊपर जो लेयर, आउटर पेरियोस्टियम ऑफ द स्कल भी कह सकते हैं इसको. आउटर septum of skull. It pericranium loosely covers the skull, except loosely covers skull except at sutural lines, except at sutural lines, where it is continuous with the endocranium via sutural membrane. Clinically, cephalohematoma. It is a collection of fluid beneath the pericranium. It produces localized swelling in the form of a cephalohematoma. कैसी swelling होगी? Localized होगी. Localized swelling. And identifying जो point होगा इसका identifying point जो है swelling shape of related or corresponding bone. Next, nerve supply of the scalp, atrial supply of the scalp, venous drainage of the scalp. We will study in next lecture.